Would the gentleman on mute?
There, can you hear me now?
We can hear you.
All right. Well, thank you, Mr. Chairman. Secretary, thank you for testifying before us here today. I have some real concerns with President Biden's budget. I think it manages to raise taxes on middle and low income Americans while simultaneously in a position where I think we're headed toward not being able to make good on our promises on a path to bankruptcy. So I really want to be sure that the American people are hearing this. So I'll say it again. This budget raises taxes on all Americans, including those who the president said he wouldn't raise taxes on. And we know that even the money raised through this is still not enough to pay for all the proposals in the budget. This budget includes a provision to create a public option, coupled with the $163 billion in subsidies in the plan to try to make the Obamacare plans more affordable. Both proposals do nothing to lower the actual cost of health care, to boost innovation, or to improve access. And what's more, the budget includes promises to seniors by expanding Medicare fee-for-service benefits without having the money pay for those new benefits. And I'm concerned that'll further erode Medicare solvency and drive up premiums in the Medicare Advantage plans. These ideas in this budget are bringing our nation one step closer to adopting a healthcare model that's used in socialist countries. And I believe that socialist medicine means fewer cures, and delayed or worse, even denied care. Coverage does not equal access. There's a lot that we can do to improve access. And by the way, I want to mention telehealth has been mentioned many times in this hearing. And I want to share one unique use from my district. I represent Lancaster County in Pennsylvania, which is home to tens of thousands of Amish constituents. And I'm sure you're aware that they don't typically use electronics, but even among the Amish, some seek necessary care during the pandemic and engaged in what they do is audio-only telehealth visits. So telehealth is helping to reach underserved communities throughout the nation, even populations like the Amish in my area. So if there's one area of bipartisan work that can be accomplished this year, I hope to work with the administration to make sure that we can continue to provide the access that telehealth has provided, and that doesn't go away at the expiration of the public health emergency. But Secretary, a public option is really a partial government takeover of our healthcare system. And as I mentioned, I fear that will undermine the employer-sponsored market and threaten Medicare solvencies. Providers are already facing cuts to their reimbursement rates, and they'll be forced to charge the private market more just to make up for insufficient government payments. And in turn, 157 million Americans, by the way, currently obtain their coverage through the private market. They will likely see their premiums rise, including seniors on fixed income. And in the meantime, none of this makes a single improvement to the quality of care. We'll be pressuring physicians and hospitals to do more for less, and I fear that this will result in upheaval of the healthcare market. And in fact, it might be the intent to quickly force us all into Medicare for all. But a quick question, do you agree that the underlying budget will let the tax cuts enacted under the Tax Cuts and Jobs Act for middle and low income Americans expire?
Congressman, thank you for the question. I do look forward to working with you in the future. Please make sure you reach out to my team if we can be helpful in anything. The president's budget actually increases the opportunities for middle-income families, and I hope that what we have a chance to, since my time has expired, is to go into some of that in detail.
Thank you, Mr. Chairman.
Thank the gentleman. I want to thank Secretary Becerra for joining us today. I know he's on his way to the other chamber, but as an alum, you'll be pleased to note that we think you'd be better off staying over here with us. Please be advised that members have 2 weeks to submit written questions to be answered later in writing.